Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Ms. Johnson. I understand that you've been experiencing digestive issues, and you're looking to modify your diet to help alleviate these symptoms. Is that correct?
Yes, that's right. I've been struggling with stomach pain, bloating, and irregular bowel movements for quite some time now. I'm hoping that changing my diet might help.
Of course, we'll do our best to help you. Can you provide some details about your current eating habits and what your typical meals look like?
Well, I usually start my day with a bowl of cereal or toast with jam, and I drink coffee. For lunch, I tend to have a sandwich with some kind of protein, like turkey or tuna, along with a salad or some fruit. Dinner varies, but I usually have some type of meat, a starch like rice or pasta and vegetables. I snack on things like chips, crackers, or yogurt throughout the day.
Thank you for providing that information. Based on what you shared, it seems like you're consuming a variety of foods. However, there might be some adjustments we can make to help with your symptoms. For instance, have you considered increasing your fiber intake?
I've heard that fiber can help with digestion, but I'm not sure how much I should be consuming or what foods I should eat to get more fiber.
That's a great question. Generally, women should aim for around 25 grams of fiber per day, while men should aim for 38 grams. Foods that are high in fiber include fruits, vegetables, whole grains, legumes, and nuts. You can try incorporating more of these foods into your diet to increase your fiber intake.
That sounds doable. What about my coffee habit? Could that be contributing to my digestive issues?
It's possible. Caffeine can stimulate the digestive system, which might lead to increased bowel movements or even diarrhea in some people. You could try cutting back on your coffee intake or switching to a decaffeinated version to see if that makes a difference.
I can give that a try. Are there any other dietary changes that might help my symptoms?
You mentioned that you consume dairy products like yogurt. Some people are sensitive to lactose, a sugar found in dairy products, which can cause digestive issues. You could try eliminating dairy from your diet for a short period to see if your symptoms improve. Additionally, some people find relief from symptoms by following a low FODMAP diet, which eliminates certain types of carbohydrates that can be difficult to digest.
I've heard of the low FODMAP diet, but it seems a bit complicated. Do you think it would be worth trying?
It might be helpful, but I would recommend making some of the simpler changes we discussed first, like increasing your fiber intake and reducing caffeine. If you don't notice any improvement after making those adjustments, we can revisit the idea of trying a low FODMAP diet.
That sounds like a good plan. What about supplements? Are there any that might help with my digestion?
Some people find relief from digestive issues by taking probiotic supplements, which contain beneficial bacteria that can help promote a healthy gut environment. You might consider trying a probiotic supplement to see if it helps with your symptoms.
I'll look into that. I really appreciate all your advice. I'm hopeful that these dietary changes will help me feel better.
I'm glad I could help. It might take some time for your body to adjust to the changes, so be patient and give it some time. If you don't notice any improvement after a few weeks, or if your symptoms worsen, don't hesitate to reach back out. We can explore additional options and make further adjustments to your diet as needed.
Thank you. I'll be sure to keep track of my symptoms and how I'm feeling as I make these changes. I'll definitely reach out if I need more help or guidance.
You're welcome, Carla. Everyone's body is different, and what works for one person may not work for another. It's essential to listen to your body and adjust your diet based on how it responds. If you have any questions or concerns, please don't hesitate to contact me. I'm here to help you on your journey to better digestive health.
I really appreciate your support. This has been very informative, and I feel more confident about making these changes to my diet. Thank you so much.
I'm confident that with time and perseverance, you'll find a dietary approach that works best for you. Good luck, and please don't hesitate to reach out if you need further assistance. Have a great day.
Thank you. I'll be in touch if I have any questions or need more help. Have a great day as well.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Mrs. Johnson. Your primary care physician has referred you to me because they suspect you may have a heart-related condition. How can I help you today?
Yes, that's correct. I've been experiencing some discomfort in my chest and shortness of breath recently.
I see. Can you provide more details about your symptoms?
Well, it started a few months ago. At first, I felt a mild discomfort in my chest, but I didn't pay much attention to it. As time went on, the discomfort increased and became more frequent. I also started feeling short of breath, especially when climbing stairs or walking long distances.
Have you experienced any other symptoms like dizziness, nausea, or fatigue?
Yes, I have felt dizzy and nauseous on a few occasions, mainly after the chest discomfort. I've also been feeling more tired than usual, but I thought it was just because of my busy schedule.
Thank you for sharing that information. Have you noticed any factors that seem to trigger or worsen these symptoms?
I've noticed that my symptoms are worse when I'm under a lot of stress, like at work or when dealing with family matters. They also seem to get worse after a large meal or when I'm lying down.
Do you have any history of heart disease in your family?
Yes, my father had a heart attack in his 50s, and my grandfather also had heart problems.
It's important to consider family history when assessing potential heart issues. Have you made any lifestyle changes in response to your symptoms?
I've tried to eat healthier and exercise more, but it's been challenging with my busy schedule. I did quit smoking last year, though.
That's a significant step towards improving your heart health. What tests or treatments have you undergone so far?
My primary care doctor performed an EKG, which showed some irregularities. They also took some blood tests, but the results have not come back yet.
Based on your symptoms and family history, I would like to conduct further testing to get a better understanding of your heart health. Have you ever had a stress test or an echocardiogram?
No, I haven't.
A stress test involves monitoring your heart while you exercise, and an echocardiogram uses ultrasound to create images of your heart. These tests can provide valuable information about the functioning of your heart and help us determine if there is an underlying issue that needs to be addressed.
I understand. What are the treatment options if a heart problem is found?
Treatment options can vary depending on the specific issue. They may include lifestyle changes, medication, or in some cases, surgical intervention. Our primary goal is to determine the cause of your symptoms and develop a personalized treatment plan to address it.
I'm worried about the impact this could have on my life. I have a demanding job and a family to take care of.
It's natural to be concerned, but it's important to address potential heart issues early. The sooner we can identify and treat the problem, the better your chances are for maintaining your quality of life. We will work together to find a solution that fits your lifestyle and allows you to continue doing the things you love.
Thank you, doctor. I appreciate your help.
You're welcome. We'll schedule the necessary tests and follow up with you to discuss the results and develop a treatment plan. In the meantime, continue to make healthy choices and don't hesitate to contact my office if you have any concerns or if your symptoms worsen. Remember, we're here to support you and help you maintain your heart health.
Thank you, doctor. I will do my best to make those healthy choices and look forward to finding out more about my heart health.
That's the right attitude, Laura. Taking care of your heart is a lifelong commitment, and we will be here to guide and support you along the way. I'll see you again after your tests, and we'll discuss the next steps. Take care.
Thanks again, doctor. I appreciate your support and guidance. Have a great day.
You too, Laura. Stay well and see you soon.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Good morning. How can I help you today?
Good morning. I've been experiencing some tooth sensitivity and pain in my lower left molar.
I'm sorry to hear that, Sarah. Let's take a closer look. When did you first notice the pain and sensitivity?
It started a couple of weeks ago. At first, it was just mild discomfort, but it has been getting worse.
Have you noticed any triggers for the pain, like hot or cold temperatures, or when you eat certain foods?
Yeah, I feel a sharp pain when I have something hot or cold, and it's especially bad when I eat sweets.
Thank you for the information. That helps. I'll perform an examination to see what might be causing the issue. It could be a cavity, an exposed nerve, or even gum recession. Please lie back and I'll take a look. I found a cavity in your lower left molar, which seems to be the cause of the sensitivity and pain. It's still in the early stages, so we should be able to treat it with a filling.
Oh, I see. That's a relief. What does the procedure involve?
First, I'll numb the area around the tooth with a local anesthetic to ensure you're comfortable during the procedure. Then, I'll remove the decayed portion of the tooth and clean the area. Finally, I'll fill the cavity with a dental material, which will help protect the tooth and alleviate your symptoms.
How long does the procedure usually take, and is there any downtime afterward?
The whole process should take around 30 to 60 minutes, depending on the complexity of the cavity. You may experience some mild numbness and sensitivity for a few hours after the procedure, but you should be able to resume your normal activities shortly after.
That doesn't sound too bad. Can we schedule the appointment for the filling?
Of course. Let's get you scheduled. How about next Tuesday at 2 p.m.?
That works for me. Thank you. I appreciate your help.
You're welcome. I'll see you next week, and we'll take care of that cavity for you. Remember to keep up with your regular dental hygiene routine to help prevent future issues. Have a great day.
Thank you.
Now look at question 26.
Nutrition is a vital aspect of overall health, as it influences numerous physiological processes, including growth, development, immune function, and the ability to heal. Inadequate nutrition can lead to a variety of health problems, such as nutrient deficiencies, obesity, and chronic diseases like diabetes and cardiovascular disease. As health professionals, we are uniquely positioned to guide our patients toward better nutrition. We can assess patients' nutritional needs based on their age, sex, weight, and health status, develop personalized meal plans that incorporate specific dietary requirements, monitor patients' progress, and provide support and encouragement. Educate patients on the benefits of a balanced diet, portion control, and mindful eating. By staying informed about the latest research and guidelines in nutrition, we can provide the most accurate and helpful advice to our patients. To provide optimal care, it is crucial to base our recommendations on the latest scientific evidence. This involves staying up to date on current dietary guidelines and recommendations, emerging research on the impact of specific nutrients and dietary patterns on health, the safety and efficacy of dietary supplements and functional foods, the role of nutrition in disease prevention and management. Remember, nutrition is an ever-evolving field, and our understanding of the relationship between diet and health is continually expanding. It is our responsibility to stay informed and adapt our practice accordingly. To optimize patient outcomes, we must work together as a team. Interdisciplinary collaboration is essential for providing comprehensive care that addresses the complex interplay between nutrition, lifestyle, and disease. This can include partnering with physicians to address medical concerns and manage comorbidities, nurses to monitor patients' vital signs and provide necessary care, psychologists to address emotional and behavioral aspects of eating habits, physical therapists to design and implement appropriate exercise programs. By working together, we can create a cohesive and integrated approach to patient care.
Now look at question 27.
Good morning, doctor. I've been experiencing some persistent headaches and fatigue over the past couple of weeks.
I'm sorry to hear that. Can you tell me more about your symptoms? For example, when do these headaches occur and how severe are they?
They usually start in the afternoon and last until I go to bed. The pain is moderate, but it's affecting my daily activities. As for the fatigue, I just feel constantly tired, even after a full night's sleep.
Thank you for the information. Have you noticed any triggers for your headaches or any patterns in when they occur?
I haven't noticed any specific triggers, but they seem to be more frequent on work days.
All right. Have there been any changes in your routine or stress levels recently?
Yes, actually. I started a new job a month ago, and the workload has been quite demanding. That could be a contributing factor.
Let's discuss your sleep patterns. How many hours do you sleep each night, and do you have any difficulty falling or staying asleep?
I usually sleep for about 7 hours, but I've been waking up a few times during the night lately.
It's possible that stress and disrupted sleep are causing your headaches and fatigue. I recommend trying some stress management techniques, such as deep breathing exercises or meditation, and maintaining a consistent sleep schedule. Additionally, try to take regular breaks during work and ensure you stay well hydrated.
I'll give those suggestions a try. Is there anything I can take for the headaches in the meantime?
You can take over-the-counter pain relievers like ibuprofen or acetaminophen for temporary relief. However, if your symptoms persist or worsen, please come back for a follow-up appointment so we can investigate further.
Now look at question 28.
I'm here to check your vitals and change the dressing on your wound. Have you had any discomfort or pain since last night?
Just a little bit of pain, but nothing I can't handle. I'm actually more worried about how long I'll have to stay here.
I understand your concerns, Mr. Thompson. Your progress is quite promising, but we need to ensure that you're well on the road to recovery before we can discuss a discharge plan. On a lighter note, is there anything you're looking forward to when you get home?
Definitely. I can't wait to spend time with my family, especially my grandchildren. They're growing up so fast, and I don't want to miss a moment with them.
That sounds lovely. It's important to have something to look forward to while you're recovering. In the meantime, let's focus on getting you better. How's your appetite been?
To be honest, I'm not a big fan of the hospital food, but I've been trying to eat as much as I can to regain my strength.
I know hospital food isn't always the most appetizing, but it's crucial to eat well to help your body heal. If there's a specific type of food you prefer, let me know, and I'll see if we can make adjustments to your meal plan.
That's very kind of you. I appreciate it, Nurse Emily.
You're welcome. I'm here to help. And don't forget, our physical therapist will be coming by later today to work on your mobility exercises. It's crucial to participate fully in the sessions as they'll help you regain your strength and independence more quickly.
I'll do my best. I'm determined to get back on my feet as soon as possible.
That's the spirit. Your positive attitude plays a significant role in your recovery. If you have any concerns or questions, please don't hesitate to ask. We're here to support you every step of the way.
Now look at question 29.
The primary objective of this presentation is to explore the importance of incorporating innovative solutions and evidence-based practices into our occupational therapy practice. We will discuss the role of technology and research, as well as the challenges and opportunities presented by these advancements. As you are all aware, occupational therapy has a long history of helping individuals with disabilities and other challenges to live more fulfilling, independent lives. Over the years, our profession has evolved significantly in response to changing societal needs and scientific advancements. Today, we face an exciting but challenging era where technology and evidence-based practices are becoming increasingly relevant to our work. Recent years have seen a surge in technological innovations, many of which have the potential to revolutionize the field of occupational therapy. Some examples include virtual reality, VR, and augmented reality, AR, or for immersive tailored rehabilitation interventions, robotics and exoskeletons to assist with mobility and functional tasks, telehealth and remote monitoring platforms to increase accessibility and continuity of care, mobile apps and wearables to track and encourage progress in self-management. While these advancements hold great promise, it is crucial that we, as occupational therapists, remain critical and well-informed to ensure the effective and ethical integration of technology into our practice. In addition to embracing innovative technologies, it is vital that we continue to uphold the principles of evidence-based practice, EBP. EBP involves the integration of best research evidence, clinical expertise and judgment, client preferences, and values. By keeping up to date with the latest research and evidence, we can ensure that we are providing the most effective and appropriate interventions for our clients. Collaborating with researchers and fostering a culture of inquiry in our profession is essential to achieving this goal. Adopting new technologies and evidence-based practices in occupational therapy is not without its challenges. Barriers such as limited funding, lack of training, and resistance to change may impede our ability to embrace these advancements. However, these challenges also present opportunities for growth and development. By fostering a culture of curiosity, collaboration, and continuous learning, we can overcome these barriers and propel our profession forward. Overcome these barriers and propel our profession forward.
Now look at question 30.
Hi, I'm here for an eye exam. I've been experiencing some blurry vision lately, and I think my prescription may have changed.
All right, let's get started. First, can you tell me a bit more about your vision symptoms? When do you notice the blur, and is it worse at certain times of day or during certain activities?
It's mostly when I'm trying to read or look at something up close. It's been happening more often lately, and it's harder for me to focus.
I see. Have you noticed any other changes in your vision, such as double vision or eye strain?
Not really, just the blur.
Okay, now, have you had any eye exams in the past? And if so, when was your last one?
I think it was about 2 years ago.
All right, we'll definitely want to take a look at your eyes again today. Before we get started, do you have any questions or concerns about the exam?
No, not really. I'm just hoping to get some answers about why my vision has been blurry.
Of course. Now, let's start by testing your visual acuity. We'll have you read some letters on a chart and see how well you can see them.
Great, your visual acuity is 20/20ths. However, I can see some slight changes in your prescription from your last exam. We'll want to take a closer look at your eyes and make sure there's nothing else going on.
Based on my examination, I do see some slight changes in your prescription. I recommend updating your glasses or contact lens prescription to improve your vision. Additionally, I don't see any signs of more serious eye conditions, but we'll want to monitor your eyes over time to make sure everything stays healthy.
Okay, that sounds good. What do I need to do to update my prescription?
We can get you set up with a new glasses or contact lens prescription right here in our office. We'll also want to schedule your next eye exam in about a year to make sure your eyes are staying healthy.
Thank you. I really appreciate your help.
You're welcome. If you have any other questions or concerns, feel free to ask. Otherwise, we'll get you set up with a new prescription and you'll be on your way.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Hello, my name is Amy Johnson, and I'm a specialist diabetes nurse assisting patients in managing their diabetes effectively. Today, I'd like to talk about my work, focusing on the various aspects of care and support I provide, particularly for a patient I have been working with recently. Let's call her Lisa. This case will help demonstrate the different elements of managing diabetes and the importance of providing education and support for patients. Diabetes is a prevalent condition, affecting millions of people worldwide. In the UK alone, there are approximately 4 million people living with diabetes, with type 2 diabetes being the most common form. Diabetes can lead to various complications if not managed effectively, such as heart disease, kidney damage, and vision problems. This is why my role as a specialist diabetes nurse is crucial in helping patients understand and manage their condition to minimize the risk of complications. Lisa, a 45-year-old woman, was recently diagnosed with type 2 diabetes after experiencing symptoms such as increased thirst, frequent urination, and fatigue. Like many people, Lisa was initially in denial about her condition, reluctant to accept the changes she needed to make in her lifestyle. However, after discussing the potential consequences of poorly managed diabetes, After discussing the potential consequences of poorly managed diabetes, Lisa decided to take charge of her health. My first step in supporting Lisa was providing her with comprehensive education about diabetes, including the role of blood sugar levels, the importance of regular monitoring, and the various factors that can affect blood sugar, such as diet, exercise, and stress. Blood sugar, such as diet, exercise, and stress. We also discussed the different medications available and their potential side effects, allowing Lisa to make informed decisions about her treatment plan. Together, Lisa and I developed a personalized plan to help her manage her diabetes effectively. This included making dietary changes, such as reducing her intake of refined carbohydrates and sugary foods, and increasing her consumption of whole grains, fruits, and vegetables. We also worked on incorporating regular physical activity into her daily routine, starting with simple exercises like walking, and gradually increasing intensity as her fitness improved. As a specialist diabetes nurse, I continuously provide support and guidance for Lisa throughout her journey. We schedule regular follow-up appointments to assess her progress, make adjustments to her treatment plan as needed, and address any concerns or challenges she may face. Additionally, I encourage Lisa to participate in local diabetes support groups where she can connect with others who share similar experiences and exchange valuable information and advice. In our area, we have community-based diabetes clinics where patients like Lisa can receive ongoing care and support closer to home. These clinics allow staff to build relationships with patients, offer personalized advice, and monitor their progress more effectively. Although we don't have definitive evidence, we believe that community-based care is more beneficial for patients than attending a large hospital clinic. Our goal is to expand the availability of these clinics, ensuring that more individuals have access to the support they need in managing their diabetes. Although Lisa was initially reluctant to accept her diagnosis, she quickly realized the importance of managing her diabetes effectively. With the education and support I provided, Lisa became more confident in managing her condition and made significant lifestyle changes, which resulted in significant improvements in her blood sugar levels. In recent times, telehealth has become an increasingly important tool in managing diabetes. As a result of the COVID-19 pandemic, many healthcare professionals have turned to telehealth to provide remote care to patients. This method allows patients like Lisa to receive support and guidance from the comfort of their own homes, making it easier to manage their condition effectively. Managing diabetes can be challenging, and it's essential to consider the impact it can have on a patient's mental health. As a specialist diabetes nurse, I work with Lisa to identify any emotional or psychological challenges she may be facing and provide appropriate support and referrals to specialist services if necessary. There is still much research to be done in the field of diabetes care and management. The development of new technologies and medications could provide significant advancements in treating diabetes and minimizing the risk of complications. Additionally, further research into the effectiveness of community-based care, like the clinics we have in our area, could provide valuable insights into how healthcare professionals can best support patients in managing their diabetes. As a specialist diabetes nurse, I provide education, support, and guidance to patients like Lisa, helping them manage their diabetes effectively and minimize the risk of complications. By working together, we can develop personalized plans that incorporate dietary and lifestyle changes, regular monitoring, and ongoing support. As we continue to develop new technologies and research, the future of diabetes care looks promising, and I'm proud to be part of a team working towards better outcomes for patients living with diabetes. You.
Now look at Extract 2. Extract 2, Questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today we're talking to Dr. Lisa Sanders, an expert in Lyme disease and an infectious disease specialist in the USA. Dr. Sanders, what is Lyme disease and why is it considered a growing concern?
Lyme disease is an infectious disease caused by the bacterium Borrelia burgdorferi. It's transmitted to humans through the bite of infected blackleg ticks, commonly known as deer ticks. The initial symptoms can be mild and include fever, fatigue, headache, muscle and joint aches, and swollen lymph nodes. If left untreated, the infection can spread to joints, the heart, and the nervous system, causing more severe and long-lasting complications. Lyme disease is a growing concern because the number of reported cases has been steadily increasing, and it's now the most commonly reported vector-borne illness in the United States.
Right, I see. How is climate change affecting the spread of Lyme disease?
Climate change plays a significant role in the spread of Lyme disease. Warmer temperatures and milder winters have allowed tick populations to expand their geographical range, and as a result, the areas where Lyme disease is prevalent have also expanded. This means that more people are now at risk of being exposed to the disease, and it's crucial that we take steps to protect ourselves and raise awareness about the disease.
And for the benefit of our listeners, can you describe an individual case?
Sure. I recently treated a patient named Emma, a 35-year-old woman who loves hiking and spending time outdoors. After returning from a camping trip, she noticed a small red rash on her leg, which she initially dismissed as a bug bite. Over the next few weeks, Emma began experiencing fatigue, joint pain, and occasional headaches. She decided to visit my clinic, where we performed tests that confirmed she had Lyme disease. Thankfully, we caught it early, and she's now undergoing treatment with antibiotics.
What are the challenges in diagnosing and treating Lyme disease?
Diagnosing Lyme disease can be challenging because its symptoms often mimic those of other conditions, such as the flu or other viral infections. Additionally, not all patients develop the characteristic bullseye rash that's typically associated with Lyme disease. This can lead to delays in diagnosis and treatment, increasing the risk of long-term complications. As for treatment, most cases can be successfully treated with a course of antibiotics. However, some patients may continue to experience symptoms after completing treatment, a condition known as post-treatment Lyme disease syndrome or chronic Lyme disease. The exact cause of this syndrome is still unclear, and it remains a subject of ongoing research.
What can people do to prevent Lyme disease and raise awareness about the issue?
Prevention is key when it comes to Lyme disease. People should take precautions to avoid tick bites, especially when spending time in wooded or grassy areas where ticks are commonly found. Some preventive measures include using insect repellent, wearing long sleeves and pants, and checking for ticks after spending time outdoors. Additionally, raising awareness about the disease, its symptoms, and the importance of early diagnosis and treatment can help prevent the spread of Lyme disease and reduce the risk of long-term complications.
Thank you, Dr. Sanders. Can you tell us a bit more about the geographical areas where Lyme disease is prevalent and how it's spreading globally?
Sure. Lyme disease is most commonly reported in the northeastern and mid-Atlantic regions of the United States, as well as in the upper Midwest. However, it's also been reported in other areas of the country, such as the West Coast. Globally, Lyme disease is most prevalent in Europe, where it was first identified, but it's also been reported in Asia, Australia, and parts of South America. The spread of Lyme disease is largely driven by changes in the environment, such as deforestation and urbanization, which can create new habitats for ticks and increase human exposure to them.
That's interesting. Can you tell us about any new developments or treatments for Lyme disease?
There's ongoing research into new treatments for Lyme disease, including the development of vaccines and alternative therapies such as herbal medicine. However, prevention remains the best approach, and it's essential that people take steps to protect themselves from tick bites. Additionally, raising awareness about the disease and its symptoms can help people recognize the signs of Lyme disease early on and seek prompt treatment, which can improve outcomes and reduce the risk of long-term complications.
How can individuals who believe they may have been exposed to Lyme disease get tested and receive a diagnosis?
If someone believes they may have been exposed to Lyme disease, they should seek medical attention as soon as possible. A healthcare provider can perform blood tests to look for antibodies to the bacteria that cause Lyme disease. However, it's important to note that these tests may not be accurate in the early stages of the disease, and some patients may require further testing or evaluation to confirm a diagnosis. It's essential to seek medical attention promptly, as early diagnosis and treatment can help prevent the development of more severe complications.
Are there any long-term effects or complications associated with Lyme disease?
Yes, there can be long-term effects and complications associated with Lyme disease, especially if it's left untreated or not treated promptly. These can include joint pain and inflammation, heart problems, and neurological symptoms such as numbness, tingling, or difficulty concentrating. In some cases, patients may develop a condition known as post-treatment Lyme disease syndrome, which can cause ongoing symptoms such as fatigue, joint pain, and muscle aches. It's important to seek medical attention if you experience any symptoms of Lyme disease, even if they seem mild or go away on their own, to prevent the development of long-term complications.
What are some misconceptions or myths about Lyme disease that you would like to clear up?
There are many myths and misconceptions about Lyme disease, which can make it challenging to diagnose and treat. One common myth is that you must have a bullseye rash to have Lyme disease, but in reality, only about 70 to 80% of patients develop this rash. Another myth is that Lyme disease can be transmitted from person to person, but in reality, it's only transmitted through the bite of an infected tick. Finally, some people believe that chronic Lyme disease is a separate and distinct condition from Lyme disease, but in reality, it's not recognized as a separate condition by most medical organizations, and its cause and treatment remain a subject of ongoing research.